correlational method is known for describing how two factors relate to each other. So it's describing a relationship between two variables. Now it's important to keep in mind that correlational methods are not looking to seek out what the cause of something is. They're simply looking to describe what the relationship is between two variables. A couple of well-known research designs use correlational methods, such as epidemiological studies. So studies that want to look at how common certain mental disorders are within a certain population. They can look at whether certain populations are more at risk for certain mental disorders. But again, that's not saying that something is causing the mental disorder. It's just saying that this disorder is more prevalent within this community than that community. So simply describing something. The other experimental design that often uses a correlational method are longitudinal studies, which is looking at a variable over time in the same individual as they get older. So looking to see how the mental disorder is associated with the age of onset and what the likelihood is for, say, schizophrenia to be diagnosed in the teen years as opposed to in the 20s or 30s. So likelihood of having a psychological disorder being diagnosed. What's important to keep in mind is that correlation is about the relationship between two variables. So you can have a relationship that is positive, meaning that the, say you wanted to ask, are stress, the level of stress you experience, and the likelihood of being diagnosed with a mental disorder, are those two things related? So you look at the level of stress on one plane, and you look at the likelihood of being diagnosed with a mental disorder on the other plane, and you see if the more stress someone experiences, the more mental disorders that they have been diagnosed with in that population. So what you often see is the higher level of stress, the more psychological disorders are reported. So that is a positive correlation. So let me just draw that real quick. So you have your y-axis here, your x-axis there. Stress, mental disorder, we could just be lumping mental disorders together, such as anxiety, depression, schizophrenia, just for the sake of this example. And if you have a positive correlation, that means that these two things are going to go together, meaning the more stress you have, the greater your likelihood of being diagnosed with a mental disorder. Now, again, correlation is not saying that stress causes mental disorders. It is simply saying that those two things are associated together, that there's a relationship, that there is a positive relationship. Now, another thing you can look at with correlational methods is the strength of relationship, how strong this correlation is. Now, I drew a pretty nice, perfect linear line here, but it could instead look very different. We could get a very mild correlation. So it depends on your measure. You may have a very strong correlation, you may have a weak one, you may have something that's completely not at all related to stress. So you're looking at both the magnitude of the relationship as well as the positive or negative quality of the relationship. So let's look at another question. So what if we were asking if treatment responsiveness and a specific culture were correlated? We wanted to know if certain cultures were more responsive than others. So then we pick out a certain culture and we find within this culture that treatment responsiveness is less the more culturally ingrained someone is. So you have cultural affinity, and you have responsiveness to treatment, or treatment response. And that means the stronger the cultural affinity, the less they're going to respond to treatment. So what have I just described here? I've just described a negative relationship. So again, the opposite of what we were just talking about. Correlations describe relationships between two variables. This is showing a negative association or negative relationship between the amount of cultural affinity someone has and their ability to respond to a specific type of treatment, say it's psychoanalysis or cognitive behavioral therapy or even a drug therapy. For whatever reason, a subset of this population has significantly less ability to recover from that treatment. All right, so those are some examples of correlation. It's about the strength of relationship and the type of the relationship. Those two factors combine to create a correlation coefficient, which is a numerical value that you can put on your correlation when you do your statistics in these methods. You can read more about it in your module as well as your textbook, and please discuss this in your discussion this week. And next I'm going to talk about experimental design.